Thank you everybody for joining Living Well Through Weight Management, presented by Advocate Good Shepherd Hospital, Advocate Aurora Health. Just a reminder, this event is being recorded and we are currently live on Facebook. This presentation will be recorded and posted then on our YouTube station. Before we really get started, let me just take a quick moment to explain a little bit about ElderWorks. ElderWorks is a non-for-profit 501c3 organization whose mission is to provide older adults, seniors, and their families information, referrals, guidance on senior living, home care, and supportive services to help them make appropriate decisions and enhance their lives. This includes education on senior topics for community members and professionals. The guidance we provide will help many seniors stay home and well, or transition successfully into a new senior housing opportunity. If you have any questions throughout the presentation today, please use the question answer button on your screen to ask questions. Please note that you will be muted during the presentation. After the webinar, there will be a short survey for you to fill out. It'll pop up on your screen, and we would appreciate any feedback that you have. It's a way we can improve. Just quickly, I am hosting today. My name is Dina. I am a social services specialist for ElderWorks. And now I would like to turn the session over to Amy. She is a weight management provider and nurse practitioner. Jen, she is a program coordinator. And then Mike is the health educator, all again from Good Shepherd Hospital, Advocate Aurora Health System. Take it away, guys.
All right, well, thank you, Dina and Emily and ElderWorks for having us. We're very excited to share with you today about living well through weight management. As Dina mentioned, we are from Advocate Good Shepherd in Barrington, and we are part of the weight management team. So in our time together today, we are going to discuss why maintaining a healthy weight is important. You're going to have the opportunity to learn about the different options for weight management at Good Shepherd. We'll discuss next steps for getting started, and then we'll have a time of Q&A, and then you'll also be given our contact information as well in case there's any further information you'd like, or if you think of any questions later or want to explore signing up for our program. So I'm going to turn it over now to our nurse practitioner, Amy, and she's going to discuss a little bit more about why healthy weight is important.
Hello there. Thank you very much for having us. Welcome, everybody. Thanks for the introduction, Jen. As she mentioned, I am the nurse practitioner for our weight management program here at Good Shepherd. We have been up and running since the fall of 2019, so right before COVID hit us. And we've been going strong ever since. So, you know, we are here to talk about weight and obesity and, you know, so what is obesity? Obesity is a condition characterized by abnormal fat accumulation or abnormal fat. So obesity is a chronic disease, and it's been recognized by the American Medical Association since 2013 as a chronic disease. So complications of obesity, and of course this is not limited to these, but type 2 diabetes with these, you know, disease processes underneath them, peripheral vascular disease, kidney disease. Then we go into the cardiovascular, so issues to do with your heart, high blood pressure, high cholesterol, coronary artery disease, strokes. And then, of course, sleep apnea and fatty liver, as we call the NASH syndrome, arthritis, infertility, musculoskeletal injuries, and premature death, unfortunately. And there's a bunch of cancers that also are contributing factors to obesity as well. Next slide, Jen. So unfortunately, the prevalence of obesity in the United States is pretty high, and it continues to grow. Over 40% of Americans are categorized as obese, and over 70% of US adults are either considered overweight or obese. So those are quite high numbers, and we need to take a hard stance and treat this as any other disease we would treat. And unfortunately, it's just not treated that way. So we see here on this map, you can go back just for 1 second. I just want to say one thing. We see here that, Colorado here is in the green. It's got the lowest obesity rate. And then we have all these red states here right in the Midwest. And, this was just pointed out to me not too long ago, how this Iowa and downwards, it looks like a man with a belly kind of holding like a pizza. And I didn't even notice that, but it's been in some of my talks, people speaking were like, look it's a man holding a pizza, right in that area. But so, these numbers continue to grow. So we need to really focus on trying to reduce those numbers, or at least not have them increase the way they are currently. So what do we have here to offer at Good Shepherd? So we have a weight management team that's surrounded by multiple other approaches and other team members that can help with these with helping you reach your healthy weight. We have our weight management coordinator, who's Jen, who we heard from earlier this morning. So within our program, we have our HMR program, which we will be talking more about that as well a little bit later. Our fitness center, we have a slew of fantastic dietitians that can help you. Our diabetes program, of course, our weight management, and then our bariatric program. So what is weight management? Weight management is where I come into play. I see all of our weight management, all of our patients that come in seeking an appointment, whether they are having just weight struggles, they are not at an extreme obese level, but they just can't get anything moving on the scale. So there's no restrictions to who can come see me. You don't even have to be categorized as overweight to come see me. Just maybe someone who wants to maintain where their current weight is. I do really focus on having my patients feel heard and in a non-judgmental way. I do a lot, significant amount of time. So there's questions and answers, and people can really feel like they're in a safe environment to have those questions answered. I do obtain a health history, get lab work ordered. We can do nutrition counseling and talk about physical activity, medication. I'm not opposed to medications. There's a lot of really good anti-obesity medications on the market now that have excellent results. And of course, referring out to bariatric surgery as well. Treatment plans, I do require all of my patients to track what they're eating. Tracking is all about accountability. So many patients may come in and say, I don't eat a lot. And that could be very, very true. And I see it quite often, but you could be eating the wrong things. So we need to really take a deep look into what people are consuming. setting goals, practicing mindful eating. Every patient has an individualized plan. There is not one plan that is the same. There's not one treatment plan that's the same for my patients. Like I said, medications when it's appropriate, and HMR, which is our meal replacement program, that is also an option as well. Our bariatric surgery program is outstanding. We have a group of 4 fantastic surgeons. If you are bariatric surgery appropriate, that would mean that you have a BMI over 40, or you have a BMI over 35 with a comorbidity. So that could be high blood pressure, that could be diabetes, sleep apnea, it could be arthritis, high cholesterol, you know, and the list can go on and on. So just if you don't think, you know, that you may not be appropriate for bariatric surgery, it's an excellent time to come in and see if you are. And that's, you know, things that we talk about. You do have to not have a alcohol abuse problem and or drug abuse problem. And you have to have a controlled psychological condition like, you know, anxiety, depression, or binge eating per se. Some of those conditions, you know, you have to be stable with that as well. Some of the contraindications would be, you know, if you're on unacceptable risk, if you are unable to follow post-op instructions. So that's something that's super important for long-term success, is to have, you know, to be able to follow post-operative plans. And it's something that you work at for years to come. So it's not a quick fix. It's not the easy way out. It's something that you have to work at ongoing. And you can go on, Jen. So these are some of the comorbidities that actually could be resolved after bariatric surgery. As you see, I love this depiction of this lady here. So, you know, many people don't realize that a lot of these comorbidities on here can improve and or completely go away with weight loss. So obesity is an inflammatory process in your body, and a lot of these disease processes have to do with inflammation. So it's amazing, you know, people can get off of blood pressure medication, diabetes medications, their depression or anxiety have improved. Fertility issues. I know how many times people have had surgery and then, you know, lo and behold, 6 months later, they're pregnant, you know. So it's amazing how many of these diseases can improve or go away after surgery. Bariatric surgery is safe. It's safer than having your gallbladder removed or hip replacement. The death rate is very, very low. It's less than 1%. And you have a higher risk of having complications or death from having your gallbladder removed or your hip replaced. So if you look here, death, oh, that's okay. Yeah, you can go back, yeah. So death-related diabetes reduced by 90%, heart disease is reduced by 50%, and then just overall reduction in your mortality rate is almost 90%. So it definitely is a good option for those people who, you know, it's indicated for and are bariatric appropriate. Our bariatric program is an accredited comprehensive center. We are up for reaccreditation this fall again, so that's exciting for us. We have a dedicated inpatient bariatric unit, and we have a support group that's led by myself monthly. Patients do receive a 12-month fitness center membership for you and a significant other, and that's redeemable at any of our fitness centers affiliated here with Advocate and Good Shepherd here up in the North area. Thank you.
Thank you, Amy. Now I'm going to touch on HMR. Amy mentioned that is one of our options through our weight management program. HMR stands for Health Management Resources, and it is our structured weight loss program. So here you can see kind of a high level view of what is all involved in HMR, and we'll talk more specifics. It does involve group coaching. We have weekly classes that are currently meeting over Zoom, and Mike, who you'll meet soon in the presentation here, he does teach those weekly classes along with check-in, midweek check-in with our participants. There's a lot of accountability, encouragement, motivation that you'll get in the class. Aside from talking about how to best stick to the program, you'll talk about struggles, successes, but as well as talking about long-term healthy habits that you'll want in place for maintaining and keeping the weight off that you lose on the program. Accountability, again, Amy mentioned that she has her patients track. Part of HMR is tracking as well, a point of accountability, being intentional about what you're taking in, as well as your behavioral and lifestyle changes. There is structured diet and nutrition that we'll talk about. The program utilizes meal replacements to really take a lot of the guesswork out of what to eat, what to prepare, while providing your nutrition, and then making sure that you're staying full and satisfied. And then as well as Mike works with our patients, there's a lot of discussion about physical activity, figuring out what you like to do, what you enjoy doing, and getting into that real habit of that long-term physical activity. HMR does have medical supervision. Everyone doing the program through our clinic at Good Shepherd goes through an initial health assessment. And our clinical team, Amy, along with our nurse, Kristen, really check in with our patients, especially those that are on meds that need to be monitored or health conditions that need to be monitored while losing weight on the program. And then they're able to also communicate with any specialists or primary care physicians that you have as well. So you really get a full team approach while on the program. The HMR program is a phased approach. Phase 1, you're really looking at that quick start to weight loss, which is really motivating. Our patients see the weight coming off and they stick with it and see great results. So in that phase, that's where you're really utilizing the meal replacements, again, as I mentioned, to take the guesswork out of what to eat. You're following the structured program with the HMR foods, and then some will choose to add in the fruits and vegetables as well. So it's a time-limited phase. It's not forever. We don't want you to be eating out of a boxed entree the rest of your life, and you probably don't want to either. So on average, we see anywhere from 20 to 22 weeks in phase 1, but we really work with you to make the program what is the support that you need and what's going to work best for you. So we've seen people stay in phase 1 longer. We've seen people go through phase 2 quicker. And then again, it's really up to the individual. Some people wait till they hit their weight loss goal. Others wait till they're getting closer and they're ready for more added variety. So that's when we work with you to sort of phase out of using the meal replacements and you start adding in more of those fruits and vegetables, lean protein, whole grains. And you're really looking at then maintaining. You've done all that work in phase 1 to take the weight off. Phase 2, your focus is keeping the weight off. So because of that, we really recommend someone stick with phase 2 for a year. That way you're getting through every season, every holiday, and we really help you navigate real life, just the challenges of the year of traveling, going to restaurants, maybe getting through difficult anniversaries and just different parts of life. So really keeping the weight off. And then phase 3, that's the ultimate goal, really having you be able to maintain on your own. Of course, we're always here for ongoing support and accountability as well. And here on this slide, you'll see just a visual of what those meal replacements in phase 1 look like. So at a minimum, we want you taking in 3 shakes and 2 entrees a day. If you're doing fruits and vegetables, you'll add in 5 servings. The nice thing with HMR is you're not counting points or calories. The big thing that we work with you is to make sure you're taking in at least that minimum, so you're getting your nutrition and staying healthy and feeling well. But if you are hungry, you are always welcome to have more, and we encourage that. We want to make sure you're staying satisfied while seeing the weight come off. Here on this slide, you'll see HMR collects a lot of data. This is their published weight loss data for people who have done the program. So this is what you'll see on average. Some lose more. Those top 2 lines are our clinic programs. Decision Free is the program that you would do where you're not adding in fruits and vegetables. Healthy Solutions is where you're adding in fruits and vegetables. There's an at-home variation of HMR, and that's where you'll see the bottom two. You can do at home while still taking part in a weekly class taught by the HMR corporate coaches, or you can also do HMR at home on your own. So what you can see from this data, as you're in the clinic, the more accountability you have, we really see that people lose a little bit more weight. Just again, you have the whole team checking in with you and keeping you accountable. And then our last slide here for HMR is one of our patient success stories. If we had more time, there would be so many that we would want to share with you. But this is Jay and Terry, a married couple that did the program together. I know there's kind of a lot of data to look at here, but really they lost a lot of weight, lowered their BMI, went off meds, their lab work improved. They're no longer suffering from chronic pain. They both eliminated blood pressure medication and really had a lot of great things to say as far as the friends that they made, and then being able to keep this as a lifestyle, not just a quick diet change, but really being able to keep the weight off long-term and being satisfied with what they're eating. So now I'm going to turn it over to our health educator, Mike, and he's going to talk about what is needed to maintain a healthy weight.
Thanks, Jen. As Jen and Amy said, I'm the health educator that works with the HMR program, working with our patients to lose weight through those phases, as Jen had pointed out before. So really talking about where we start with maintaining a healthy body weight, I always like to start with physical activity. We find that any amount of physical activity that you're going to be doing is better than none. If you are used to doing very little activity, I'd like to start with very small, attainable, bite-sized goals, as in maybe 10 minutes 3 times a week, just to get you in the habit of setting a specific time during your day or during your week, that is all you're going to do for those 10 minutes. If you do more than 10 minutes, that's fantastic. That's great. And I would encourage that. But as long as you're hitting those small goals, that's what we're looking for, because we're going to build on that adherence that you yourself are building. So, and with that comes additionally extending that time. So if you're going to walk for 10 minutes, then we can go ahead and add 2 minutes week by week. And in 5 weeks, you've already doubled the amount of time that you're walking, for example. A combination of both, Jen. A combination of both cardiovascular and strengthening exercise. As we get older, muscle maintenance, it becomes very important for just our activities of daily living. Cardiovascular health, of course, really making sure our heart and lungs are pumping really well, and making sure they're circulating blood as they should. So again, with physical activity, we see increase in cardiovascular function, cognitive function, anxiety and depression, as Amy mentioned earlier, and of course, physical function and independent living, as I mentioned, as the importance of continuing those strengthening exercises. We see decreases in risk for falls, coronary artery disease, and as I previously mentioned, anxiety and depression. In regards to nutrition, just generally what we like to talk about mostly with our phase 2 group is to closely follow the dietary guidelines for Americans. Those guidelines are published every 5 years, and they look at trends that we have seen in the past 5 to 10 years and what things we should try and focus on for that next half decade. So the guidelines for these past 5 years are as follows. This first one is follow a healthy eating pattern across a long period of time. This is what we are trying to improve year by year, month by month, because as we see healthy eating patterns over a long period of time versus smaller, acute, maybe fad diets, is that people are willing to continue their healthy habits and they are losing weight and maintaining their weight over a longer period of time. Focusing on variety, nutrient density, and amount. Really hitting hard those fruit and vegetables to round out your meal. Fruits and vegetables are going to be what help crowd out some of those unhealthy foods and some of those unhealthy oils. They're going to help you feel satiated without wanting to reach for more of those high calorie choices. limiting calories from added sugars and saturated fat. So this is sugars from pastries, from cookies, fat from high-fat animal products, sausage, red meats. These things we're finding are detrimental to our cholesterol. They increase our risk for cardiovascular disease, and of course, diabetes. So really looking to limit these and can get a better understanding of what they're doing for our bodies, which is almost essentially nothing, but looking to curb that. And then the last one, shifting to healthier food and beverage choices. So using low-fat dairy products, if you aren't lactose intolerant, and substituting those for low fat instead of the full fat. Using seltzer waters instead of regular soda. Really trying to cut out some of what I talked about in number 3, some of those added sugars and saturated fat that provide little to no benefit in our diets, while still being able to enjoy similar taste or foods. And then as Amy mentioned earlier, tracking, this is a very important skill. It's something that applies to every meal, to every snack. Portion control plays a very large role in overeating and of course weight gain. So utilizing tools to measure proper servings of foods, measuring cups, spoons, food scales. What I like to mention with this is, if possible, use a smaller plate size. We find if the plate is larger, we're going to want to fill it up, because if we don't, it looks empty. So if we use a smaller plate and fill that smaller plate up, we're already prepping ourselves for a better chance of over-serving ourselves. And like I said here, if utilizing measuring cups and spoons, really getting a good idea of what foods should look like and what serving should look like, versus just saying, here's a big couple spoonfuls of rice, versus actually using tools to measure that out, if possible. Tracking using a food journal or an app, this can really be a good reflection, so you can look at what variety you might still need in your diet, or understanding what foods do to your weight, and understanding a certain kind of association between the two. This is a fantastic picture I always love to use. This is a great example that follows the My Plate recommendation. So it looks like we have probably somewhere around 4 ounces of protein here on the plate. We have carbohydrates, but notice that half of the plate are fruits and vegetables. As I was saying before, we're looking to round out and really bulk our meals up with those fruit and vegetables to crowd out any of those other more unhealthy foods. So this is a great visual and a great example of what we're looking for when we want a well-rounded dinner or lunch plate for this example. And then Jen, I'll send it back to you.
All right, thank you. So I know our time is coming to an end here, and we've kind of given you a lot of information to digest. But if you do have more questions or are ready to get started, you can call. Our number listed here is the main number to our Health Management Center. If you know you want to get scheduled to start the conversation with Amy, you can go ahead and call our Health Management Center, 847-842-4460. To see Amy, or for bariatric surgery, or for the HMR program, we do not need any orders or referrals from your physician. We can go ahead and take care of all of that for you. Some things like diabetes education and additional nutrition counseling, we would need a few more steps, but our staff can definitely direct you and let you know what's needed when you call our main number. Also, our email address you can see here is listed, gshp-weightmanagement@aah.org. You can also email there as well. In particular, if you're looking to get started with HMR, there would be a link to a video I would send you, and we'd schedule a follow-up call to make sure you have all of your questions answered, to discuss next steps, all the details of the program, and to really have that conversation about what would be a great fit for you, whether it's the at-home program or in clinic, and which diet variation. And then as well, there is our website listed. It does say bariatric surgery in the web address there, but just know that when you click on that link, that gives all of our options to all the various programs that we discussed today. So thank you so much for the time and for having us. If there is time left over, I know we're kind of getting to the end here. We are available if there are any additional questions.
I don't see any questions in the chat as of right now, but feel free to add any questions in the chat if you would like for those participants. And we are live on Facebook, so I know Emily will jump in if we have anything from there. I will say to you guys, this I find very interesting, and I thank you for presenting for us, because I think starting with nutrition really is how you can gain a better quality of life. And in these days of everybody going 1,000 miles a minute and not having time, making the time, I can speak from personal experience, making time to make that dinner and have those fresh fruits and vegetables. It makes a difference in how even your happiness factor is. Do you guys have anything else to share with us today?
I would just echo one thing that Amy said. We know there's not a one size fits all. Mike touched on this too. There's a lot of fad, trendy diets and things that come up along the way, but we're really here to help support you specifically in what you need. Again, Amy can really specifically tailor a program. HMR might be a great fit, maybe it's not. So there's something else. Someone might be nervous about bariatric surgery or haven't thought about it, but can really come in and get some great information how it might be a great fit. So we're really here as a resource. There's something for everyone, and we'd really love to help point you in the right direction. And we're just really excited to get to walk alongside people in their health and weight loss journey.
Greatly appreciate that. I do want to let our on the webinar, we did just post our jot form for the evaluations for our attendees today. If they can fill that out, that would be amazing. And I very much recommend anybody listening to this to reach out and gain some additional knowledge. Nutrition is the way to a better enhanced life. Thank you, everyone. I greatly appreciate it. Bye-bye.